Okay, this is my audience. Hi, my name is Olivia Maynard. I'm a Liberty nursing student, and I'm a follower of Christ. Think about a time back when you were a child and you were sick with the flu and you had a fever, and your mother comes in with that cold, cool washcloth to put on your forehead, and that just makes you feel so much better. I think of that when I think of the role of nurses. In nursing, patients should be able to see the compassion and love that nurses have for them because of the compassion and love that Jesus gave to them. In this speech, I'm going to explore the occupation of nursing, the nursing process, and caring for patients, and I'm also going to talk about the role of faith in nursing. A lot of people go into nursing because they think that they can make a lot of money and there's always a they can be hired. However, they understand the deeper concepts behind nursing and the real roles of nurses. The American Nursing Association defines nurses as the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, advocacy in care of individuals, families, communities, and populations. There are 2.6 million RN jobs, which is registered nurses, in the United States, and 60% of these are in the hospitals. The average nurse makes a income of $69,110 with an hourly pay of $33.23. There's 3 ways to become an RN. You can go through the bachelor's program, you can get a associate's in nursing, or you could go through a nursing diploma program. But either way, you have to take the National Licensure Examination for Registered Nurses, which is the NCLEX RN. A lot of employers want their employees, their nurses, to have a bachelor's in nursing because that extra 2 years gives them a broader picture of nursing care and a deeper understanding of patients, and it just allows them to critically think of the patient as a whole. You can specialize in different departments, such as the emergency department, the OR. You can specialize in like people groups, such as like infants or elderly people, or you can specialize in specific illnesses. To become a nurse, you really have to enjoy school. It's hard and it takes a lot of time and just constant sitting down studying, even when you would prefer to be somewhere else, and you have to put all of your hard work into it, because really what you're doing is you're studying because you're going to take care of patients, and what you're studying now actually affects people's lives, and they will die if you don't know your stuff. To work as a nurse, you have to be time and detail oriented. You have to be a team player. You also have to have compassion, gentleness, willingness, and discretion to be an honorable nurse. The nursing process is assessment, diagnosis, planning, implementation, and evaluation. This is how nurses, this is how they assess each patient, and this is how they care for them, and it's kind of a constant, they do it and then they evaluate, and if it works, they keep doing it. If it doesn't work, they stop. Patient safety is a big aspect in nursing. We're talking not just like a physical safety, like from falling or from like, I don't know, but also an emotional safety and safety from infection, which nurses can control through washing their hands. Through nursing, a Christian nurse can show their faith through compassion and love for the patient, especially since they're in this extremely vulnerable situation. Matthew 14:14 says, "And when Jesus went out, he saw a great multitude, and he was moved with compassion for them, and healed their sick." And then John 13:34-35 says, "A new commandment I give to you, that you love one another as I have loved you, that you also love one another. By this all will know that you are my disciples, if you have love for one another." And these are both from the New King James Version. These are just talking about the love and compassion that Jesus had for others, and the love and compassion Jesus had for that he expects us to have. We are dirty and sinful and just terrible people, and yet God loves us. And when our patients are angry and scared and throwing poop at us and just it'd be easy to yell back at them, but really we need to be able to show the love and compassion that Christ has for us. So nurses care for people, and they also care for healthy people through prevention and education. We are to be the hands and feet of Christ in the medical field. And to summarize all of this up, Christ died for us, and so we're to die for self. And because we die to self, we're to do what he asks us to do. And if that asks us to be a nurse, we're to care for people. So, thank you so much for listening to my speech, and have a wonderful day.
Okay. It is at exactly, okay, how do I turn the